in people, cancer is a reportable disease, meaning that if you or I got diagnosed with cancer, our doctors would have to report that to a registry so that it was kept track of. Animals, it's not reportable, meaning that if your pet was diagnosed with cancer, your veterinarian is not required to report it anywhere. And if you talk to veterinarians, they'll tell you this is the number one cause of death in our pets. And it is the number one reason that you will lose time with your animal in their lifetime. But the good news is that this is a preventable disease. The majority of cancers do not show up on blood unless it's a blood cancer. So for us to be able to see cancer, we need to have 1 centimeter of a tumor. In people, it can take 25 years for that to happen. And in dogs, it can take 10. Cancer does not grow in healthy soil. And that soil has to be sick over many, many years to allow that weed to be there. We are sold that prevention is early detection. That is not prevention. That is early detection. What I'm here to share with people is that we already have the cure for cancer. It's to not get it in the first place.
Welcome to the DAFY podcast, the place where you will get expert-led and science-backed advice on dog health and nutrition. No more confusion and no more conflicting opinions. Just clear guidance to help you make informed decisions for your pup. Because when it comes to our dogs, they deserve the very best care. And we, as dog parents, deserve confidence in the choices we make for them. Let's meet an expert. Dr. Kendra, welcome to the DAFY podcast. It's so great to have you on today.
Thank you. So excited to be here.
Likewise, you are the first vet oncologist I am interviewing, so I'm very, very looking forward to this. But first of all, can you tell the audience a little bit about your background?
Yeah, sure. So being a veterinary oncologist means that I went to veterinary school, but then after veterinary school, I had another 4 years of training just to do conventional oncology. And that was great. I loved that. But very early in my career, I realized that my heart was in integrative and non-traditional therapies. And so while I was in veterinary school, I also began training in traditional Chinese medicine. And that was kind of what started the shift in a different direction for me. And so alongside my conventional oncology training and my Chinese medicine training, which taught me herbs and acupuncture and things along those lines, I've also kind of fallen down the rabbit hole of lots of different modalities. So whether it be using lots of different herbs, nutrition, ozone therapy, mistletoe therapy, IV nutrients, functional medicine, toxin screening, I, over the years, have found myself consumed with the vast, exciting field of natural integrative holistic medicine. And so I've spent the last 15 years just diving into that. And about 2 years ago, started training veterinarians to be integrative cancer care practitioners. And about a year and a half ago, started teaching pet owners how to prevent cancer in their pets. So I still practice, but my focus has been shifted a little bit to education because there's so much of that, as you know, that needs to be done now.
Yeah, I absolutely love that. Sounds like you're very busy as well.
You know, it's one of those things which I imagine you understand because I know you're very passionate about this too. When you're doing work you love, you just want to do more of it, and you can't help yourself. You're just always doing something.
It's like a drag.
Yeah, because you see the impact it makes for people and you just want to keep doing it. It is like a drug. I totally agree.
I love it. I absolutely love it. And you said your heart went into when you were at vet school, your heart went into, kind of like moving into more of like an integrative approach.
Yeah.
As opposed to conventional. Why did your heart why did your heart go to that way as opposed to the more kind of like conventional path?
Yeah. I love when I'm given this opportunity to kind of tell this story because I feel like when you hear about people, how they got here, it was always something that like the universe put them on a path and they didn't realize that they were there until they had a chance to turn around and look back and be like, oh, now I see all those little pieces that were, laid along to develop where I am. So I decided to become an oncologist because I had a personal loss. My father died when I was 22 of cancer. And so I knew that that was the place I needed to make an impact. But the natural and holistic piece came in when I was at the University of Florida in veterinary school, and they have a very robust integrative medicine program and introduced us to acupuncture very early. And I was getting chest pains from the stress of veterinary school. And I went to my doctor, had all the conventional tests done, but they ultimately decided it was quote unquote stress and they handed me my anti anxiety medications. But when I would take them, I would fall asleep and then I would be even more stressed because I had taken a nap instead of been studying. And I very quickly realized like this doesn't work. And during that time, there was an acupuncture lab that was going on that was showing us how it works. And the veterinarian was explaining all the benefits of acupuncture, one of them, which was stress reduction and relaxation. And I was like, well, shit, why don't I try this? And when I did, my chest pains went away, right? The first treatment. And as long as I stayed consistent, they never returned. Still to this day, I actually now can go pretty long between my acupuncture treatments and can maintain the chest pains not being there. And so that moment, along with my history of this loss and knowing I wanted to affect in the cancer space, it was this total aha of like, there are all these other tools in the toolbox that are not being utilized that are going to be just as effective with less side effects. And it was like, duh, this was what my purpose was. So, really grateful for the life happenings that got me on my path.
I love that. I absolutely love that. It's an amazing, amazing story. And it just shows like the power of alternative therapies. Why do you think these therapies are just not utilized as much as they should?
Yeah. There's so many people that have so many different theories about it. And I feel like even in my own career, what my answer to this has evolved. And what I feel like the answer is it's really twofold. One is that all of these therapies were our mainstream therapies. They are what we used to use primarily as treatment, even when we talk about herbs. So many of our pharmaceuticals, definitely our chemotherapy, are derived from botanicals. And these are the things that we originally used. But in the advent of pharmaceutical companies, there was a large shift to really make it clear that there was no place for them and that they weren't necessary anymore. And that really all these pharmaceuticals were better than them and they were left behind. And so that was part of it. The other part of it is that there is a dialogue and a dogma and a bias that exists in all medical schools, whether it's human or animal, that there is no research for any of these. And that is a lie. There is so much research for all of these. In certain instances, there are more research for these types of treatments than there are for the conventional ones. And so there is a lot behind the scenes of motives who are driving research products, who are profiting from research products, who are paying for research. And so there is a lot of rabbit holes that you can go down. But the bottom line is that the medical community believes the bias that there is no research, which is an untrue statement. And we were made to believe that there was no place for these and we forgot about them. But the good news is that pet parents and many health practitioners are recognizing that there's a huge place for them because there's a huge gap that we have in the therapies we do have. And these natural treatments, interventions like food, interventions like herbs, interventions like nutrients can fill those voids that we need so desperately from the holes that pharmaceuticals leave in trying to treat disease.
Yeah, I absolutely love that. That is so incredibly true. And I am starting to see, even from starting DAFY a year ago, the amount of more integrative, kind of like, conventional vets moving from being just conventional to integrative now. And yes, you're right. It's just about more people getting the word out there, but also like conventional vets just actually trying these alternative therapies and seeing results in real life. And I think that's so powerful. I think there is still a little bit of work to do. Many conventional vets will move into integrative when something happens to them or to a dog in their family or something like that. There is still something that has to happen before they move to that. But there is just so many more integrative kind of like vets and specialists out there. And it's just so beautiful to see because, yeah, I agree with you. The research is out there. I feel like from a dog owner perspective, it's really difficult because I go to the vet and I get told something and I have been taught to believe my local vet. and not to go online and look for alternatives. But the reality of it is if you know who you're looking for and the people that are not local to you are experts and have years of evidence-based and expert-led like advice, then why not, right? If that can help your sick dog or your dog from getting sick, there is nothing more powerful, isn't it?
Totally. And I think that a big misunderstanding that I had when I went to medical school, and I think that many pet owners have, is that when you become a doctor, when you go to a doctor, whether it's your veterinarian or your own personal doctor, you think that they know everything. We don't know everything. And the worst part and the most dangerous part is that we don't know what we don't know, right? There's this whole portion of things that we're unaware of that there would be no way for us to know what that is because we don't know what it is.
Yeah.
And so I really respect the veterinarians that have enough self awareness and are humble enough that if an owner comes to them and wants to know something, instead of them just saying, no, that's not right, or no, there's no evidence for that, they instead say, I don't know anything about that, but there are people who do. Because the reality of the situation is, modern medicine has really only been around for about 200 years.
Yes.
And our traditional medicine has been around for 3,000 years. And so there's actually much more clinical experience and anecdotal experience in traditional medicine than there is in modern medicine. And I think that the conventional community, depending on, who you are and your paradigms, that can be very threatening to you. And so I think that pet owners are becoming aware that it is their duty and their right to be their pet's advocate, and that they are now able to do that because of access to information, like the kind that you're giving to your community, like the kind that's available online. And they can start to form their own opinions with the help of trusted colleagues.
Yes, I completely agree with you. And I think dog owners are starting to see, okay, there is so much crap advice out there. I'm now like, who are the right people that I should be talking to here, as opposed to just going into like a Facebook group, random Facebook group, and just, listen to anyone who's giving me advice. And I think that's such an important distinction, right? Because I go and talk to Dr. Kendra versus I go and talk to a, Facebook group of, dogs that have got cancer and have going through chemotherapy. It would be completely different advice that I get from one place and the other. And I think, I am part of this Facebook group called something like Homemade Dog Food, 400,000 people. And I see the amount of misinformation in there can be incredibly dangerous for dog. And this is just kind of like, tick the boxes once again of really making sure you're talking to the right people and you are getting the information from sources that are actually experts in that field. So yeah, I love that. I love that.
Yeah. There's so
Absolutely love
many
that.
opportunities to access information, but you're absolutely right. It doesn't mean that there is lots of excellent information.
It's all about educating who the real people are, or who the real experts are, and why, and what kind of qualifications do they need to have, etc. Right? So yeah, I love that. So let's talk about cancer. Tell me a little bit, first of all, what you see on the industry in terms of not in the industry but in the world, right? Like the reason why I got into dog nutrition is because 5 years ago when Rusty was a puppy, I watched a TED talk by Rodney Habib, and he was talking about how 60% of dogs are overweight, out of which, like 80% are likely to develop cancer in their lifetime, all of this thing. And that was my aha moment where I was like, okay, I can't let that happen to him. He's a little baby, he's depending on me. I need to do everything in my power to make sure that doesn't happen, because cancer is real. I can see it on me all the time with people. So where are we nowadays with cancer in dogs? Yeah, how real is it?
Yeah. And that's a really good question. And it gives me an opportunity to kind of point something out to the listeners here about the data that we have on those numbers that are always quoted, which they're scary, right? The numbers that are quoted are 1 in 3 dogs in their lifetime will get cancer, 1 in 3 cats in their lifetime will get cancer, and that one out of 2 dogs over the age of 10 will get cancer. The thing about those statistics is they are from studies that were done in the 80s. Those
Mm,
studies are more than 40 years old. And you would say, well, why are they so old? And why don't we have more recent data? And the answer to that question is that in people, cancer is considered what's called a reportable disease, meaning that if you or I got diagnosed with cancer, our doctors would have to report that to a registry so that it was kept track of. Because as you could imagine and guess, it's important for us to be keeping track of this. What type of cancers are developing? How old are the patients that are getting it? What stage are they being diagnosed at so that we have a pulse on what's happening? Well, in animals, it's not reportable, meaning that if your pet was diagnosed with cancer, your veterinarian is not required to report it anywhere. And frankly, there is nowhere for us to report it
Yes.
if we even wanted to. That does not exist. And a pet owner got wind of this back in 2021 and they did a big survey. They surveyed over like 30,000 pet owners. They had like 800 dogs that were diagnosed with cancer and they surveyed to see what was going on with the prevalence and incidence of cancer because we've always assumed it was the same as people. Whatever's going on in people is what's going on in our pets. Well, what they found is that that was not true. What they found is that it was actually 5 times higher in dogs than it was in people. And that study wasn't talked about in the community. Nobody brought it up. Nobody's trying to figure out why. As far as I understand, after that study was done, it just all died. But why is that happening? And if you talk to veterinarians, I mean, they'll tell you this is the number one thing that we see all the time. And this is the number one cause of death in our pets. And it is the number one reason that you will lose time with your animal in their lifetime. And so, in my opinion, which obviously people can assume that I'm a little biased by now, in my opinion, this is the most threatening thing to your pet's life. But the good news is that this is a preventable disease. We are not taught that. It is not marketed as such. We are not made to believe that. One of the biggest myths and lies that we've been told is that it's just bad luck, and none of that is true. And so it's really important for pet owners to understand for their pets and for themselves. There is a cancer crisis for all of us, and it's driven by our environments and that means that we have control over what happens.
Wow. Yeah, that is powerful. That is very incredibly powerful. And this is the thing is that it's like cancer is unless you see it, it's kind of like people don't believe in it. You know,
Yes,
it's like everyone is living, we're all living in a toxic world and we're all living a crazy lifestyles where, we will eat ultra processed food. And it's literally the same for our dogs, isn't it? And it's like, as long as my dog looks fine, he goes for his health check, nothing is wrong. But the problem is you can't see it. And
absolutely.
sometimes you won't see it until it's too late. And sometimes you won't see it at all.
Absolutely.
And I can tell you a little story. I had the doggy daycare and boarding business for 3 years before I started DAFY. And I had this collie that used to come to me for 3 years. It was 2 years ago in December. I had him for a week. He was like 12. No, sorry, 10. I was throwing the tennis ball at him. He was like full of energy still, bringing me back the ball. And then 2 weeks later, the owner messaged me and she said, we had to put him down. And I was like, excuse me? Liver cancer. So all of a sudden, he just started fainting. He started being really sick. And that's it. I was like, excuse me, liver cancer? I was like, how is that not been picked up before? Like, surely. And that for me was the kind of like the scary moment where I was like, yeah, it's there. We just can't see it.
I hear that story a lot where
Mhm.
owners are told where it's happened to them or a close friend or a family member where their dog was just at the vet. All their blood work looked fine. All the diagnostic tests they did were fine. They got a clean bill of health. They said, this is a great exam. Everything looks good. No lumps and bumps. We're happy to see you in a year. And 2 months later, 3 months later, they have terminal cancer.
Oh,
And it happens in people too, right? We've all heard those horrible stories, my father included. He was diagnosed in March and he died in December, 8 months later, right? And so we all know these stories of where, air quote, everything is fine. And then all of a sudden, the pet or the person is dying of cancer. The lie that we are told is that it just popped up overnight. So I'll share with the audience some studies that were done that figured out how long does it actually take for cancer to be able to be detectable by the tests that we have, things like ultrasound, CT scan, x-rays, right? Because the majority of cancers do not show up on blood unless it's a blood cancer. So for us to be able to see cancer on an x-ray, an ultrasound, on a CT scan, we need to have 1 centimeter of a tumor. And in that 1 centimeter of tumor, you have 1 billion cancer cells present. That's how many you need to make that size of a tumor. Now, how long does it take to go from one cancer cell to multiply to a billion? Well, in people, we have studies that it can take 25 years for that to happen. And in dogs, it can take 10.
Wow.
So that means that there are 10 to 25 years where our conventional tests cannot pick it up, but there are things happening that can be detected by other ways, like integrative diagnostics, other types of functional approaches. And there these types of clinical signs or symptoms that you pick up as an owner and you feel yourself. You're a little bit more tired. Oh, you're not sleeping as well. You maybe have pains here and there, but they're always attributed to aging or something else that's non-specific because our regular tests don't pick them up. But the reality is that cancer does not grow in healthy soil. That is something that I always share with pet owners. I give this analogy of a garden with weeds, and that weed is the cancer. It will not grow in healthy soil. And that soil has to be sick over many, many years to allow that weed to be there. And so, spending time in the garden worrying about nutrition, worrying about inflammation, worrying about vaccines, worrying about hormone health, worrying about flea and tick products, worrying about toxin load, all of those little things contribute to the health or the sickness of the soil that's going to address that weed. The other thing that's really, really important for pet owners to know is that this can feel really scary. But the really cool part is that in that time between 1 and 1 billion cancer cells, the body can still take control back. It
Mm,
knows how to do that. It's
mm.
fighting cancer cells in our body every day. You have them, I have them, our pets have them, and our immune system is strong and it knows how to eradicate them. But if it gets too sick and too toxic, it can't do it anymore. So even when cancers are really early and not detectable by our tests, there are things that we can do to say, no, you don't, and put it back in remission and help the body to restore its normal functions. So it's really important for me and my messaging and my mission to start to educate owners about that, not only for their pets, but for themselves too.
I love that. That's such a powerful story because you could have just now been in a clinic working there for like 50 years of your life, just helping sick dogs going through cancer. But instead you've made your mission into, how do I prevent this from happening in the first place? And that's very powerful. And yeah, I love it.
One thing that is really important for people to also understand about prevention is we are sold that prevention is getting your mammograms, getting your
Mm.
colonoscopies, having lumps aspirated, for your pet. We are sold that prevention is early detection. That is not prevention. That is early detection. That is, just 1 billion cancer cells instead of 2, 3, or 4 billion cancer cells. What I'm here to share with people is that we already have the cure for cancer. It's to not get it in the first place. And we have the ability to do that by true primary prevention, which is being the gardeners and playing in the soil. And so understanding the difference between getting my mammograms and getting colonoscopies and living an anti-cancer lifestyle is completely different things.
Yeah, I love that. And what is an anti-cancerous lifestyle? How does that look like in dogs if I was a dog owner that wants to just go ahead
Yeah.
and change things straight
Yeah.
away?
So there are so many things in our lifestyle that we know affects our risk of cancer. There are things like body weight. So if there's obesity present, there are things like diet. How processed is the diet that you consume? There are things like toxin exposure. How many toxins are kind of stuck in your body, and how good is your body at getting rid of them? Things like pesticides and mold and heavy metals. There are factors like viruses, We actually know that about 40% of cancers in people are driven by viruses. And so if you take just those four things I mentioned, there's actually studies in people that 90% of cancers will be preventable if you control for those four factors. And so what that looks like is going to be a little bit different for every person for how much resources of time and energy and money they have, but everything and every choice you make is always moving you and your pet's health towards cancer or away from it. There is no neutral at all. It's either a decision that makes them move away from cancer or it's a decision that makes them more likely to have cancer. And so, in pets who are very healthy and very young, this can be a process that you can do very slowly over many years. In an owner of a dog that has a senior that maybe has built up more of these negative parts, then maybe you want to do it a little bit faster. But it's about just honestly thinking about the decisions that you're already making every day and just knowing that they are moving the needle away from cancer, not towards it. And the biggest thing that's needed about that is just to be educated about what we're doing because so many of us don't realize that when we plug air fresheners into the outlets, we're putting endocrine disruptors into our environment. So many people don't realize that when they only filter their water with the refrigerator, they're still consuming carcinogens. So many people don't realize when they're cooking on nonstick pans, they're consuming carcinogens. So many people don't realize when they're using plastics to store, they're exposing themselves to endocrine disruptors. And so it's just about becoming aware of the choices that you're making every day and the risks that they have so that you can very easily, very slowly over time have huge impacts on the risk for yourself and everyone in your family, including your dogs.
Yeah. I really like that. I really, really like that. And so let's talk about food, right? Because I think nutrition is a huge part
Yes.
of, kind of like cancer prevention. So what is your view on that? And, how does kind of like diets fit cancer prevention?
Yeah. I always tell owners if there's only ever one thing that they can do, it's always to start with the diet. And the reason that this is so important is it's because it's a choice you make all day, every day, multiple times a day. And you are basically delivering messages to your dog's body on how to interact with its environment. The food is a messenger, right? It's saying, hey, genes that help to keep my immune system strong, I'm going to either keep you strong or weaken you. Hey, genes that are responsible for what's called tumor suppressor or tumor activation, basically the gas or the brake pedal for cancer. Hey, I'm either going to turn you on or turn you off. Hey, genes that are responsible for cleaning up my insides and taking out the garbage and making sure that my blood sugar is balanced. I'm going to tell you what to do. The food is really the foundation of everything because it is something that we spend so much time with and that signals our body in so many ways. And so it's like when you're thinking about, man, like this sounds overwhelming, there's so much to do here. Well, just think about the things that make the biggest impact. And diet is primarily one of them because diet doesn't just include what you feed, it also includes when do you feed it? How often do you feed it? How often do you withhold it? All of those types of things. And although we have very little data, in the veterinary side for longevity, we do have a few studies. And it shows that dogs that had slight caloric restriction, fasting practices, they actually lived an average of 2 years longer. And these were Labradors. So it wasn't like little Pomeranians, it was big dogs. So significant increase in longevity of life. And so we know that the food and the choices we make interact with our body and tells it whether to stay healthy or whether to become sick. And so, when talking specifically about cancer prevention, and this is where it really pays for you to be curious about your pet, is that there are some sweeping recommendations, but it's always going to come down to the specifics. Like, what does your pet need specifically? And this is where some trial and error, this is where colleagues that you can rely on, this is where being in a community of people that are doing this that can support you can help you to figure it out. And that's why and here listening, I'm sure at some point in your life you've tried a diet that people swore by and it never worked for you, right? Because we all have different makeup that has us interact with our food differently. But the kind of general suggestions when trying to have an anti cancer diet, the primary, most important thing that you do is you feed as minimally processed as possible. So, what that means is that instead of us feeding food that is coming from a bag, that's coming from a can, it's food that you can look at it and you know exactly where it came from. It's the same for us. Instead of us heating up a TV dinner, instead of us eating food from a box, instead of us eating food from a bag, we're looking at the food and we're like, that's a carrot, that's an avocado, that's cauliflower, that's chicken. You know exactly what it is. And so, feeding as minimally processed as possible helps to decrease inflammation. It exposes our pets to less carcinogens. It causes less oxidative damage and stress in our body. And generally speaking, it usually is better for our blood sugar regulation, which we know always comes with cancer. The blood sugar is always messed up. And so, even if that means you're only feeding 10% of your pet's food as real food, that's fine. That's better than 100%. And you'll find ways over time because what you'll start to notice is that other things will get better. Their allergies will get better. Their arthritis will get better. They'll be sleeping better. They'll be more playful. Then you'll be more inclined to want to just kind of keep that momentum going. And so there's lots of other techniques, cancer fighting foods, fasting practices, there's lots of other things. But the most important one is that you're feeding as minimally processed as possible.
Yeah, I love that. And what is your view on, obviously, we are surrounded by, and we are being told all the time when you go to like a normal vet, feed this specific brand of kibble because it's science backed, because this, because that. And obviously, we do know, right? Vets are not trained in nutrition, which is okay. But I always had the argument that I never got over is the AGEs in
Yeah.
processed foods.
Yes.
And so I want to hear it from you as a preventative oncologist for
Yes.
dogs. Can you tell us what what IAG is, and why are they a problem, and we need to
Absolutely.
be aware of?
And they're the primary reason why I want you feeding the least of them as possible. So AGEs are advanced glycation end products. And what they are is they are compounds that are formed naturally when food is heated. When you cook bacon in a pan, when you toast bread, when you make that delicious crusty pizza crust, all of those are ages. The more you heat food, the more ages that are produced. Now, if there's just a few ages now and then, like you had pizza once this week, but the rest of your week you consumed no ages, your body can handle that and it can get rid of them and it knows what to do. But if you're eating ages in large quantities all day, every day for your entire life, like the majority of our pets are who are fed commercially processed food, they are consuming entirely too much that their body cannot handle. And what ages do to the body is in the name. They age the body. They cause profound inflammation and oxidative damage. And the two of those things are at the center of all chronic diseases, including cancer. So, arthritis, heart disease, kidney disease, liver disease, GI disease, allergies, autoimmune disease, neurologic disease, name any single one of them. And the primary cause of the two of them are oxidative stress and inflammation. So, limiting the amount of ages that we ourselves and our pets consume will slow down our aging process. And there are studies that show if you compare even the typical modern, I'll use standard American diet, which is highly processed, even using that in combination to our animals, they consume 100 times higher the amount of ages every single day because pet food is not heated once, it's not heated twice, it's not heated 3 times. It's heated an average of 4 times in processing. And so the amount of ages that they're exposed to is profoundly higher than even if we were eating crap all day long ourselves. And so these compounds are normal and natural, and if limited are okay. But when they're all that we're bombarding our pet system with all the time, it absolutely contributes to why their disease rates are higher, why they don't live as long, and why they spend a large portion of their life with chronic problems.
Yeah. Yeah, it's so interesting, isn't it? Because it's so hard, right? Like, again, I always try and put myself in the head of a dog owner that goes to the vet and they get recommended this food. And it's just all about the education, isn't it? Because Yeah. Like they say, oh, my dog was on gastrointestinal food from specific company. Worked. It works. But it goes back to the point you just made, which is whatever is in there worked to fix the problem they had. Fine. But that's not meant to be fed to that dog for the rest of their life. And
Yeah.
that's how I see it.
Yeah, and the big nuance that is missed a lot, and this I heard directly from a board certified veterinary nutritionist, which I appreciated that he had the guts to say it out loud in front of a room of boarded specialists, is that commercially available dog food is the best that some animals can access, right? And that might be better than eating scraps in the street for their whole lives. It might be for some populations of animals. But pet owners that are probably listening to a podcast like this, the pet owners that come to me in my clinic, they're not looking for minimal standards. They're looking for the best and what is optimal for their pet and what is going to make them live the longest, happiest life that will afford them the least health problems, both so that emotionally they don't have to deal with that, but then also they get the most time with their animal. And the nutritionist acknowledged in front of the room of the specialists that these commercially prepared diets are not optimal. They are minimal. And so there is a huge opportunity for the owners that are able and interested to reach for a higher standard for us to help them go there because these diets are not optimal.
Wow. When was that? Like, is it, I've not heard of it. Was it like a closed conference then you've been
Yeah.
to?
Yeah, it was back, oh my gosh, it was back like maybe 2019. And it was a really small conference on the microbiome, basically the gut ecosystem. And so, of course, anytime we're talking about chronic GI problems, the topic of diet comes up. And just like you said, yes, these prescription diets can improve these problems for a period of time, but they're not optimal.
Yes.
And so there is opportunities for us to do even better, and the community is starting to be honest with itself about that fact.
Yes, I love that. I absolutely love that. And so, in terms of like inflammation, right? Because cancer is inflammation, right? And there is a lot of talk about the gut microbiome in the last, I would say, couple of years, right, for dogs. And I have personally experienced like some amazing results with working with Rusty and his gut microbiome. And I've learned things I wasn't aware of, although it was, it's always been on a really good diet. But can you tell us, like if you were an owner that really wanted to get into preventative care, prevent cancer as much as we can, how important is the gut? What are the things that, every owner should be doing from a gut microbiome perspective?
Yeah. So part of the reason that the diet is the primary thing that I suggest focusing on is because it affects the gut microbiome. So there are these things called the hallmarks of cancer, and they've been around for 25 years now, and they've evolved over time. And they're basically what the conventional oncology community believes to be the drivers of cancer. And as time has gone on, they've added more and more things. And interestingly, they've all become environmental. And one of the things that they added in the most recent update was the microbiome. They finally acknowledged that the health and the balance of the microbiome is a characteristic of cancer and if cancer can become cancer or not. And most of us know that 70 to 80% of our immune system is in our gut. But the more and more we learn about the microbiome, the ecosystem of these organisms, bacteria and fungi and others in the gut, the more and more we realize it's not just a bunch of bugs. It really is the command center for everything. It tells our brain what to do. It tells our hormones what to do. It tells us whether to be obese or not. It tells us whether to have inflammation. It tells our immune system how to work. It is literally the command center for our entire bodies. And if it is unhealthy, then we are unhealthy. And it is damaged by things that we do every day. So if there's pesticides in our food, it damages it. If we use pharmaceuticals, it damages it. If we eat highly processed foods, it damages it. If we eat high carbohydrate diets, it damages it. On and on and on and on and on. And so if we don't take care to make sure that our gut health is optimal, everything else will break down. Even
Mm.
in traditional theories of medicine, like Chinese medicine, you always start with the gut because it is the center of everything. Other, Ayurvedic, medicine, lots of other traditional areas of medicine, it's always about the gut first because you can't fix the other problems if the gut isn't working well. It's how we detox, it's how we absorb nutrients. It's just the gold mine. And so when I say that the most important thing is the diet, what I'm really saying to you is the most important thing is the gut. And so there really is no way to prevent cancer or treat cancer without having a healthy microbiome.
Mm.
And so we're learning more and more and more about it. And these tests are becoming more available to pet owners, even if your veterinarian doesn't understand or know about them. And we learn more about it every day. And so, just like you said, you've noticed really amazing things. There probably isn't a patient in my practice that has cancer or not that doesn't have microbiome as part of their either testing or protocol because it's that important for every single disease and for prevention of disease.
Yeah, I totally agree with you. And it's like, you talk about nutrition, but then, the gut microbiome is, I was working with this dog owner the other day, and, her dog is completely messed up. She's tried every single food on earth, and the dog is still having allergy, itchy skin, and runny poos all the time. And I said, I can help you because her diet was just like, the usual meat and
Mhm.
veggies. I was like, I can give you as much advice as you want, and you can use the most beautifully designed, complete and balanced recipe in the entire world. But if you don't check the gut first and you don't understand what's going on in there, all of these beautiful nutrients that you're putting inside his body are just going to be lost. You're literally wasting your money. Uh, and this is the thing. I think, for like general health, this is the first thing I think anyone should start with and should be checking, I would say, at least once a year, because yeah, it's that important, isn't it? We don't do it for us either. Like, I do it more for my dog than me. So interesting.
So many people are like that. It's
Yeah,
easier for us to do it for them than it is for ourselves. It's
honestly,
not
it's
just
the
you,
love.
it's so many of
Yeah.
us. Yeah.
I blame him on the fact that he doesn't live as long, right? But it's
Yeah.
so funny. Yeah. I love that. Yes. Thank you so much for sharing that. And yes, so that's on the diet side. Can we quickly, briefly talk as well about fleas and ticks vaccination? So you've mentioned that has an impact on the gut microbiome. That can also
Yeah.
have an impact on inflammation.
Yeah.
What is your view on that?
Yeah. So I'll even like take a step back and share my philosophy about my 80/20 rule. So, you mentioned earlier we live in a toxic world, and I agree with that. And we can choose to add to it and we can choose to lessen it. And some of the choices that we make that add to it are the flea, tick, heartworm medications and the vaccines. That's just a fact. They are adding the load of toxins that the body needs to detoxify. And the reason that I suggest an 80/20 rule is that it is unrealistic for us to expect that we will not be exposed to toxins. And also, unless you are living as a hermit on top of a mountain, drinking spring water like in Norway, you probably aren't able to live a toxin free
I
life,
take it.
especially not in the United States and many of the other developed countries. And so that's not a realistic goal for us. And that is very stressful. And so what we need to decide is what is that 20% that we are okay with? And what is that 20% that we are mindfully choosing and mindfully acknowledging is a risk that we are taking but that we might want to support or minimize or do less frequently, or when we do with some extra support to our detoxification pathways. So, my answer to you about how do I feel about flea tick, heartworm, and vaccines is that it is going to be a different answer for every patient. For my young, healthy animals that have low toxin loads, that are high risk for certain diseases or high risk for certain types of transmissions, or maybe they live with people who are high risk, young children, elderly, immunocompromised, that decision might be different than if I have a very old animal who's very low risk in a very low risk home who has really high toxin levels. That's not an animal that I'm going to go suggesting gets vaccines and have flea tick heartworm medications used. And even in my practice, that's kind of how we approach. There's 3 doctors in my practice. We all have our own kind of philosophies. And, 2 of us specialize more in the really sick patients, and one of us is more in the wellness. And as you can imagine, the ones that treat a lot of really sick patients, we're not using them as often as the one is who's treating really healthy patients. And so this is just really the answer is kind of the same as what we talked about before. For every single medical intervention that we make for our pet, we should have informed consent. Meaning, we know the risks and we know the benefits, and we can decide what we want to do. Is the risk worth the benefit? And with our flea tick heartworm medications, we know, especially with the new ones, there's some really big risks that for a lot of breeds we probably shouldn't be taking. But maybe for other breeds with some extra support, they're going to be fine and it's going to prevent them from getting other diseases that could be worse. And so it really is about us being more transparent and pet owners obtaining information so that they really understand the choices that they're making and they can make an informed decision.
Yeah, I love that. Yeah, I love that. This is how I see, and that's what I love about integrative vet care, right? Is that you look at, you have both options available to you. You look at your own dog. Where do you live? Like what are they exposed to? Who do you have in the house? And then I just make an informed decision, knowing that, it can go either way, whatever you decide to. And it's the same with raw food, right? You decide to raw feed your dog. Yes, it's the least processed kind of type of food out there, but you are taking risks as well. So there is never like the perfect choice, and every single dog is different. What works for one doesn't work for another, and so it's just all about being educated and being able to make the choice based on, okay, I know everything now. I can confidently feel like I can make my decision without being confused or frustrated that I'm not getting the right answers. Which, yeah.
Absolutely. And it's dynamic, the decisions that you make early may change in time. I've definitely had a fair amount of clients who were raw feeders that in time it became better for their pet to have cooked food. Or we would try to put a pet on a raw diet and it didn't agree with them. And so we would have to do a gently cooked diet. And so there are nuances to this. And this is why it can become very confusing. This is why it's very challenging. And this is why there are not these big, robust, randomized controlled trials because
Yes.
health is not based in huge groups of people. All of us and all of our pets are individuals that have individual needs. And we don't want just a protocol that works for everyone. We want what's best for us and what's best for them. And so that comes with a little bit of curiosity and trial and error. And it's going to change over time. Pets that maybe should have vaccines when they were younger. Maybe when they get older, they shouldn't, or after an autoimmune diagnosis or after some other diagnosis, they shouldn't. And so it's definitely something that's dynamic and that we're always adjusting to make sure that it's the best decision for that pet in front of us at that time.
Yes. Absolutely love that. Yeah, and I totally agree with you. That's brilliant. So look, let's talk about what the work that you're doing, right? Because you're doing some amazing work. When we spoke a couple of weeks ago, you're building um obviously like a program, but you also talked about something called a risk assessment quiz,
Yes.
if I remember correctly.
Yeah.
So, and I love that because again, it's all about preventative ways of helping your dog not to develop diseases in the first place. So can you tell us, the audience, why have you decided to build something like that? What does that include? And, yeah, just give us a bit of background on that.
Yeah, absolutely. So, just like you said, I'm an oncologist and, I had this experience early in my career where, I would treat a client's pet and, when they would pass away, which was always much longer than we expected it to be, but when they would pass away, they would say to me, no offense, but I hope I don't ever see you again with my new dogs. And it never sat with me right because in my mind, I was always like, no, I want to see you as soon as you get a new dog because
Yes.
I want to help you start employing these things now so that you don't ever need me in this capacity again. And I realized that there was this big gap in understanding of when you should start cancer prevention. And so, not to abandon my clients that have pets with cancer, that's why we're focusing on training the veterinarian so that we can reach more patients and help more pets, in a wider capacity. But the real work and the real impact comes with sharing that information with owners now so that you can start now, so that you can intervene when the body can still take control before those 1 billion cancer cells are there. And then we're trying to play catch up. And so what I realized is that for many owners, they're making decisions every day, like we talked about, that are increasing their pet's risk, but they don't even realize it. It's not because they're bad pet owners. It's not because they don't care. It's not because it's not important to them. It's because they literally have no idea, because this is not information that is made readily available to us. And so this quiz was created so that you could just get a pulse on where you are. How high is that risk? Because it it what I have found is that when you're talking about these big scary things like cancer, it can be really natural to kind of what I call ostrich, right? Put your head in the ground. La la la, I don't want to hear about it. It's not a problem. I don't want to deal with it, because it elicits a lot of really scary emotions. And so oftentimes that can be too much to think about losing your pet, to think about them getting diagnosed with cancer, and you don't want to deal with it. And so what I'm trying to do is find gentle ways for people to start to pull their head out of the sand, take their fingers out of their ears, and just start to listen, because it doesn't have to be scary, and it doesn't have to be complicated, and it doesn't have to be hard, and it doesn't have to be expensive. There's just little things that we can do every day that 2 years from now, 5 years from now, 10 years from now will be profoundly impactful. And so it's just to give owners kind of a opportunity to say, hey, am I doing as much as I think I am? Or do I maybe have a bigger opportunity here for help? And it's to start to kind of pick up on those so that you know where you can land, because the first step is always us kind of admitting where we are, knowing where we are, and then being able to take action. And so the quiz is to help you kind of figure out, are you low? Are you moderate? Or are you high? And what can you do to take the next steps?
Yeah, I absolutely love that. That's amazing. And so they take the test, and let's say I am high. What do I do next?
Yeah. So based on kind of where you land, there's going to be a couple of things that are suggested to do right away. But as you've heard already today, we always talk about diet, we always talk about the gut, and then we talk about these really easy decisions to make in the environment, like what soap are you using? What do you use to clean the bowls? What are you using as air fresheners in your house? Because there's lots of little choices that you make all the time, like where is my drinking water coming from and what filter am I using, that people don't even realize can make huge impacts. Like in the United States, for example, I think it's some crazy number, like 80% of households have arsenic in their water, which is a known carcinogen. And people would think, how is that possible? How is it allowed to be in the water? I don't know. But what I can tell you is it's there. And it's there in really high amounts that are causing cancer and are known to cause cancer. And so just finding out these little things that require small changes can help to make you and your family and your dogs all healthier.
Yeah. And I love it because it's not just, yeah, exactly what you said. It's not just your dog, it's yourself as well. Because we live in their world as much as they do, and it's, yeah. And I feel like, and I don't know if you agree with that, I think it's in my head, before I got into all of these kind of, dog health and nutrition, is I always had this thing where it's like, oh, okay, but I can't see it. I can't see it. It's fine. I can't see it. It's not there. And it's like you said, right? It's kind of burying your head under, and it's like, oh, it doesn't exist. But it does exist. You can't see it in the water with your bare eyes, but there have been studies and the water has been tested. And there are places where you can find this information to confirm that this stuff is there in air purifiers, in water, in, the environment. Glyphosate, again, that glyphosate is a huge one. No one can see it. It doesn't exist. We are literally surrounded by it. And our dogs with their little faces on the ground, they are literally the ones that are getting the most of it in their little bodies. And, that's then what causes issues. And yeah, things like chronic illnesses. So yeah.
Absolutely. And, it's if people need more convincing that there's a problem, it doesn't take you much to find it. There are so many studies, class action lawsuits, articles, papers, especially nowadays, because there's so much transparency happening about the reality of the pesticides, the toxins, the endocrine disruptors that we're being exposed to. So, if you don't believe me, it won't take you much to find that information. And if you want more data, I love data and I'm happy to share it with you. But what my mission is not to convince you. My mission is to tell you it's happening, whether you believe it or not. And I'm here to show you the way out because we have the cure for cancer, but we're not helping people to take action to do that now. We're waiting until they get it and then we're doing something. And I know that for most pet owners, they would rather take action now to prevent it than to deal with it later. Even if you took out the completely emotional part about it, even thinking about the financial part that, the typical pet owner, if their animal's diagnosed with cancer, will spend over like $10,000. Think about how much less you would have to spend over their entire lifetime to make choices to prevent it. It would be much less than that.
Yes.
And then you don't ever have to deal with that. So my mission is not to convince you that it's happening. That's easy. The internet can do that for me. My mission is to tell you that it is and that there is a different choice that you could make and I can help you figure that out.
I love that. I absolutely love that. And then before we close off, can you share like a success story that you had where, you worked with someone from a preventative way that you had some success with, or a dog that was really sick?
I have many, 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 many cases of animals who
Love
were
it.
sick and had cancer that lived really long. And I love those stories. But I think the one that actually I would rather share is a prevention story. I have a client who she brings her three dogs to me and she's very proactive. She has insurance. And so luckily they pay for a lot of the cost of things, which is really nice. It allows us an opportunity to be really thorough, and she's just a proactive owner who has lost animals to cancer in the past. And she just doesn't want to ever go through that anymore. And she wants to do everything she can to try to prevent that. And so for all of them, we do a lot of proactive testing, which isn't just our regular blood work and ultrasound and x rays, but it's basically testing the garden, like we were talking about before, looking for inflammation, looking for toxins, looking for microbiome health, looking for things that we know can contribute it so that we can make them go away. And in one of her dogs, one of the tests that we did is a cancer screening test, which is meant to detect cancer before that billion cancer cells. And it was positive. And so we said, okay, well, let's do our chest x ray or ultrasound or blood work and see what we find. And we didn't find anything. So we retested that cancer screening test saying, okay, maybe it was a fluke, but it was positive again and it was even higher. And
Wow.
so what that told me is that there's cancer here, but we can't see it on our conventional diagnostics. And so what we decided to do was we put together an anti-cancer protocol that included changes to the diet. It included herbs that focused on inflammation, oxidative stress, and even some herbs that have some anti-cancer activity that I even use them in patients that have cancer. And 3 months later, we retook that test and it was completely normal.
Wow.
And so what that taught me was that we have so much power with our natural medicine to literally cure cancer before it's even diagnosed, and that it doesn't take a lot of work because all mom had to do was just add some supplements and change some things about the diet. And she, hopefully for the rest of her life, has saved that dog from ever getting diagnosed and losing time with her. And these are the things that every single pet owner can do if they are aware of what's happening for their pet and they have someone to help guide them. And it's not a one-off. It wasn't hard. And so these are absolutely things that if owners are aware of, they can do to have more time with their pet.
Yeah. I absolutely love that. And that for me is the biggest difference. When I started DAFY, I was like, I want it to be science backed. Everything people say needs to be science backed. Within the last 12 months, I switched from science backed to evidence led or expert led advice. And I changed the model completely of how I wanted DAFY to be, literally because of this. Because, a study, I think, you are so dependent of a company or, pharmaceutical company to pay for it. Whereas someone with your experience having a lived experience or something like that happening and seeing the results, for me is way more powerful than a study, if I need to be honest.
Absolutely.
I love
And
it.
they're both so important, and we can't throw out the baby with the bathwater of not taking any clinical experience because just like you said, it is so important, especially when we're talking about optimal health for individual patients. It's what we call in research N of 1, right? You don't care about a big study if it doesn't apply to your pet or if your pet's specific situations weren't represented in the study. It needs to be specific for every animal. And so bridging the two is where the real magic happens, right? Taking the science, taking the literature, taking the evidence that we have, and then using your clinical experience to guide for the animal in front of you. So
Yeah,
totally. Yeah.
love it. Yes, absolutely love it. That's amazing. So if an owner loved a chat today and is listening to this episode and is thinking, I really want to really get started now, or, I have an old dog, I need to do whatever it takes to prevent it to happen in the first place, and they want to work with you or get in touch with you. Can you share with the audience, do you work worldwide? Do you have any specific things that people can do to work with you?
Yeah, absolutely. So, my clinical practice is Prism Integrated Veterinary Health in New Jersey in the United States. And the only way that I am allowed to become your pet's doctor is with a physical exam, meaning you do need to come physically into the practice. Now, if you have a pet who is sick or has cancer and you would like us to help support you, your doctor can establish a relationship with us and we can work with your doctor. So, that's definitely how we help patients distantly. We also have a growing community of integrative veterinary cancer care practitioners who are actually all over the world now. We have veterinarians in Canada and in the UK and Spain. So we're growing every year, which is amazing. And you can find a listing of all of our alumni on my website, which is drkendrapope.com. But if you are a pet owner that is interested in kind of taking this cancer prevention step a step further, then that's really easy because we can become friends online, right? The internet has allowed us to be able to do that. And although I will not become your pet's veterinarian and we will not have a medical relationship, I will become your educator and your colleague and your guide. And so the first thing that you can do is take the quiz. You can assess your pet's risk. I'm going to share that with you guys so you can share
Put
it.
it in the show notes.
Perfect. You'll share it with everybody. And then if you want to take it a step further, then that's where the pet cancer prevention course comes in. And so that information I'll be sure to share so that the audience can all check out. But, this is the opportunity for me to kind of guide you over 8 weeks, exactly what to do, exactly what tests to take, exactly what's wrong, how we figure out where to start, what to focus on, where to spend our money, where to put our energy, and do exactly what I did with that client, which was find where the risk was and get rid of it so that we don't have to worry about it anymore.
Yeah. I love that. I love that. I will make sure I put all the links to your website, to the quiz, and to your social media as well on the show notes, so everyone has got that. But yeah, thank you so much. I would love to do a part two at some point in the next few
Yeah.
months. You are very knowledgeable, incredibly knowledgeable, and I think the audience is absolutely going to love this episode.
Awesome. I'm so glad. Thank you for the opportunity to let me share my message and reach more people because this is just, it's so important for me that people start to understand the message that I have to say because we've been told this lie that we have no control. And I just want to put the control back into the hands of the pet owners. So thank you for giving me a chance to do that.
You're so very welcome. Thank you so much. And thank you so much to the audience for watching. And we will see you on the next episode. Thank you for watching. If you found this episode helpful, follow us on Instagram. And if you want first access to DAFY, join our waitlist now. The links are in the show notes.